Mosaic is brought to you in part by these generous corporate sponsors. Learn how you can support Mosaic by visiting jewishpb.org/mosaic.
Welcome to Mosaic. I'm your host, Susan Schulman-Pertnoy. Mosaic is Jewish Federation of Palm Beach County's weekly news magazine, exploring the most critical issues facing Jews here and around the world. And in this season, we'll be exploring those issues via Zoom as all of us cope with the effects of the pandemic. Today, leaders in our Jewish community here and in Israel discuss what the pandemic cannot destroy: the spirit, sacrifice, and tireless dedication of those meeting the avalanche of needs. We'll be right back.
Celebrating together, overcoming together, making a difference together. During a year unlike any we have seen before, this Jewish community is helping thousands who are struggling to get by. The Palm Beaches is home to one of the largest and most vibrant Jewish communities in the world. And together, we have been a powerful force to help those who need it most.
Hi, I'm Elizabeth Smart. Please join me for Alpert Jewish Family Services No Excuse for Abuse event on February 16th, 2021 at 7 p.m. This is all about prevention of domestic abuse. Domestic abuse is horrific and there are so many people that suffer from it. It is cyclical, it keeps going, and this is our chance to try to put an end to it. So please come out and join and support us. Thank you.
Joining us today are three well-respected leaders of our Jewish community. We have Michael Hoffman, President and CEO of the Jewish Federation of the Palm Beaches, Mark Hoppen, CEO of Alpert Family and Jewish Services, and Dr. Alan Sadowski, Senior Vice President of Morse Life Health Systems. Gentlemen, welcome to Mosaic. How have your agencies responded to the surge of needs due to the pandemic? Mark, let's start with you.
Thank you. Yes, so the needs that we saw when the pandemic happened were in financial assistance was a huge area where people that had never needed help from a Jewish agency before, suddenly needed help. Financial assistance was one of the big areas, and we were fortunate that the community came together and sent us a lot of money to be able to provide financial assistance. A second area where we noticed a big need was in mental health. Before the pandemic, people were dealing with mental health issues. They just got exacerbated by the pandemic. And then new people that really maybe were borderline or weren't dealing with issues, loss of job, that's one of those life-changing kind of moments that creates new anxiety, possibly depression, and depending on how long it lasts, whether it needs some kind of clinical response. And so we saw that, and because we could not provide those services in person anymore because of the pandemic, we pivoted immediately to being able to provide those services using telemental health.
Thank you. And Alan, how are you dealing with the surge in needs?
Well, like my colleague, we do have a very robust remote portion of what we provide. But with Morse Life, we never had the option to think about closing. Most of our work is hands-on. We're serving close to 1,000 people on the campus, about 3 times as many in the community. We've had to restrict traffic, which is a great issue for our clients and their families. We've had to restrict volunteers we rely on heavily to deliver meals. We've had to do everything we could to protect our workers, which would be enormous expense for the best and the greatest protective equipment that's available. Our workers have never stopped for the greater part of this year, coming to work every day at great personal sacrifice to deliver hands-on care to those people who need the clinical health and the activities of daily living that we provide. In addition, we're going out into the community and doing hands-on care like bathing, providing meals, shopping for people, taking them to their physicians, as well as increasing our remote and telehealth capabilities.
What we found with the pandemic is, although there's a perception of a significant amount of affluence in Palm Beach County, recently this summer we participated in a study conducted by Brandeis University to assess the level of need in the Jewish community in the Palm Beaches. And what we found is that 1 in 4 people who we interviewed felt some sort of negative effect related to the pandemic. 1 in 5 said that they had lost a job because of the pandemic, because of furloughs or layoffs. We found that a significant portion of the people who are experiencing need are under the age of 50 and have families with children. And so we're seeing a significant amount of requests for services related to financial need. There's an 800% increase in requests for some form of financial assistance. That's through Jewish Family Services that Mark had talked about. At the JCC, the Mandel JCCs, 1 in 3 families that are participating in any of their summer camp programs or preschool are receiving some level of scholarship assistance. At the Meyer Academy, our day school, Meyer Preparatory School, they're seeing an increased level of need. And so we within Jewish Federation want to help all of our partners to do what we can to help prevent some of these increased financial needs and enable our constituents to receive the services that are being performed by so ably and with a level of expertise by our partners.
We constantly have to look at that myth that Palm Beach is affluent and takes care of its own and there are no financial issues. And the fact is that there are as many people who are at the federal level of poverty or just above the federal level of poverty as there are people who are very affluent. And so I've always talked about this as sort of the dirty little secret within Palm Beach County, that we have Jewish people, Jewish seniors, Jewish families who are suffering financially.
Michael, I know that the primary role of the Jewish Federation is to meet the needs of the Jewish community, but what role do we play in terms of serving the needs of the greater community in Palm Beach County?
So any way that we can help support our donors, their interest to support the general community, we work in close partnership with other organizations in the general Palm Beach community to help address issues related to food insecurity. Our Jewish Volunteer Center has very strong partnerships, and when they talk about volunteering and meal delivery, that's to the people of need in the Jewish community, but also helping support soup kitchens and doing different clothing drives and pack drives to help support other populations in the general community that are having some sort of economic need and feeling economic stress.
Gentlemen, we have to take a break, but when we come back, we're going to talk about the stress of being on the front line for your social workers. We'll be right back. Coming up, leaders in our Jewish community discuss the emotional and physical toll the pandemic is putting on our most vulnerable people.
Join adults in the Palm Beaches who are finding meaning behind the texts at the root of Judaism. Federation's Commission for Jewish Education is connecting adult learners with the life-enhancing Melton School of Adult Jewish Learning that nurtures and deepens our Jewish community worldwide. Learn more at jewishpb.org/Melton.
The pandemic has been exhausting and challenging to frontline workers. How are your social workers dealing with this? Alan, can you tell us?
I think the pandemic has had a profound effect on our social workers. Many of them were caring for their aging parents, their children are in school, they're having to juggle work with, trying to get their children enrolled and meet the school requirements. And they're dealing with people who are suffering. We've had to do a lot with our own staff to provide mental health counseling. We have teams of therapists who are looking to recognize signs of fatigue and stress within our own staff so that they can go ahead and service the people that we provide. We've lost people in our programs, and when you're a social worker or a healthcare worker and you're dealing with death and dying, it takes its toll on you. We've had to do a lot to bolster their morale so that they can continue to work and provide good quality care.
Mark, how's your team doing?
Yeah, I have to ditto what Alan said there. I mean, the social workers, they're dealing with their own individual problems and their own individual family lives. The children especially is an issue with when schools were closed and even with schools being sort of opened. And also what Alan said with loss, we have lost clients, and there's a mourning period where the social worker has to take time to mourn, but you can't give them that much time to do that because there's another phone ringing, there's somebody else they need to go take care of, and so they have to take their moment and then get back to doing what they're doing because the community needs them to do so.
It's so difficult. Michael, tell us about the issues that were facing the Jewish community prior to the pandemic that have been exacerbated because of it.
We're clearly dealing with a number of significant issues in the community that's already been articulated so far by Mark and by Alan. But we have to point out that as a Jewish community, we were confronting issues prior to the pandemic. We were dealing with issues of identity, of Jewish education, low affiliation rates in our community. Because people have less disposable income, the reality is fewer people are participating in Jewish educational programs, participating in synagogue life. We are dealing with issues related to anti-Israel sentiment on the college campus, anti-Israel sentiment even in our high schools. We still have to enable our teens and college students to be trained to confront that. We are dealing with issues of anti-Semitism and having to facilitate community security in our community. That continues. And so these issues have not gone away because we were suddenly focused on meeting the very stressing needs related to the pandemic. So as a Jewish Federation and as a Jewish community, of course, we have to do all we can to support the important work that Jewish Family Services and Morris and Kramer are doing, but we also have to maintain a focus on addressing those issues prior to the pandemic that have only increased in these past months.
So if people listening want to help, how do they get involved?
The thing to understand is this is not a limited time situation. This is going to go on for a while where the needs will continue. Jobs aren't suddenly coming back to where people that don't have jobs are going to have a similar job. We're seeing people that are maybe getting jobs, but they're either part-time or they're underemployed compared to where they used to be. So the financial need, the volunteer need, the needs of this community are going to continue for some time.
Right now, the volunteer issue is a bit of a two-edged sword because we're not really welcoming volunteers to the campus at this point. We're very hopeful that the vaccine will change that. And the same thing with doing outreach into people's homes. We're trying to limit exposure, and that's a full-time job to coordinate the hundreds of staff people we have to reduce the risk of cross-contamination. So there are several challenges.
Michael.
We clearly have opportunities to volunteer in the community. We work very closely, again, with both of our partners who are participating today to help support meal delivery throughout the entire community. Meal delivery that not only supports isolated seniors, but we're also delivering meals to families that are struggling to make ends meet and also need food supplies. We are also supporting ways in which to make check-in calls. We've made 13,000 check-in calls to participants in the Jewish community just to check in, see how they're doing, and let them know that it doesn't matter who you are, where you live, that anyone has the ability to access services that they need from any one of our Jewish institutions. A third area is obviously to support our efforts to pursue philanthropy. Alan and Mark have spoken so well about some of the increased needs in the community. And it's a source of pride in our Jewish Federation that we've been able to help them philanthropically by making grants to support the increased level of need. I think all of our agencies need philanthropy to help support their efforts. And so any different way that anyone wants to help, whether it be hands-on or whether it's through philanthropy, there's an endless level of need right now, and we need our community, and we are seeing our community come together to contribute in a variety of different ways.
Gentlemen, we have run out of time. The work you do is obviously so critical and important, and we thank you for joining us today to inform us about everything wonderful that's going on in the Jewish community. Thank you.
Thank you, Susan.
And I want to thank Alan and Mark. Their professionalism and their leadership is invaluable to our community.
Coming up, we'll zoom to Israel and talk with the head of the Jewish Agency about the effect COVID-19 is having there and how donors from our community are fueling humanitarian efforts.
Hi, I'm Elizabeth Smart. Please join me for Alpert Jewish Family Services No Excuse for Abuse event on February 16th, 2021 at 7 p.m. This is all about prevention of domestic abuse. Domestic abuse is horrific, and there are so many people that suffer from it. It is cyclical, it keeps going, and this is our chance to try to put an end to it. So please come out and join and support us. Thank you.
Joining us is Amira Aronovich, the first female CEO and Director General of the Jewish Agency for Israel. Welcome to Mosaic. On a personal note, I just want to say I met you when you first became Director General at a restaurant in Jerusalem. This is a little different venue, but it's a pleasure to have you join us on Mosaic today.
Thank you so much, and it's a great honor for me as well. And not only that it's a different place, but I would dare to say the world was also quite different then. Who would have imagined? Nevertheless, I hope with the light of Hanukkah, we will now start seeing some light in the future as well for all of us.
For those watching who are unfamiliar, tell us briefly about the work of the Jewish Agency for Israel.
So the Jewish Agency for Israel is a 90 years old organization that was born as the arm to fulfill the Zionist dream and form the State of Israel. And in the last couple of decades, we continue to take care of our core mission of Aliyah, bringing Jews to Israel from all around the world, as well as helping still to strengthen the Israeli society, mostly the more weaker and vulnerable parts of the community. But no less important, work to connect between Jewish communities and Jews around the world to Israel and to one another, believing this is a critical way to secure a global connected Jewish future.
Let's talk about the new immigrants. The word in Hebrew is olim. The Jewish Agency made headlines in December about bringing over around 400 Ethiopians back to Israel. Why did you do this mission in the middle of a pandemic?
Israel has never closed the doors to have olim come and settle in Israel in any of the tough times and wars in the past, and also not during pandemic. We kept on bringing olim. Actually, this year is about to end with about 20,000 Jews from all across the world who made the decision to move to Israel and make Aliyah, even though the very difficult circumstances. And so this is our core mission to do that, to help the Olim prepare, bring them to Israel, and help them integrate and embark on their new life. In some communities and areas, we do that understanding that the communities are under risk and have dire needs that we need to assist them, and Ethiopia is a great example of such. All through the years, we've brought more than 90,000 Olim from Ethiopia to settle in Israel. It's a very special and unique community. The estimation is that there is somewhere around 8,000 still remaining to come and make Aliyah to Israel from Gondar and Addis in Ethiopia. And we're working there on the ground based on government of Israel decisions. And we are excited and thrilled that the government has made a recent decision to bring 2,000 of the remaining Olim from Gondar and Addis. And so as quickly as we can, we want to do everything and make sure that we bring them, enabling them to reunite with their families. Many of those remaining are waiting for more than 10 years to be reunited with their families in Israel. They're living under very difficult conditions, even prior to COVID, definitely post-COVID. And so for us, the minute we have the mandate and the authority from the government, we're on the ground making everything we can to expedite their arrival.
Last year, before coronavirus, you brought in 35,000 Olim from all over the world. Can you tell us where they come from?
So they come from more than 60 countries. About 2/3 come from former Soviet Union countries, from Ukraine, from Russia, from Southern Asia, the Caucasus countries. And the other third come from all around the world, from France, from Latin America, from UK, from Australia, from South Africa, etc. During the pandemic, we have seen a huge rise in demand for Aliyah. We see great increase in opening Aliyah files from all across the world. So there is a huge interest of many, many more Jews to make Israel their home and come.
Do you think that's because there's a rise in anti-Semitism due to the coronavirus?
What we see is that this comes from a mix of factors. Some of it has to do with instability in some of the countries. The instability could come from economic crisis, like from places in Argentina or other countries in Latin America. In some cases, it comes from crises that were there even before the COVID, having to do also with anti-Semitism and anti-Israel sentiments from some countries in Europe or South Africa or as such. And in some cases, it's really interesting. It's people who never imagined, for example, that they could leave their business and make the move permanently to somewhere else. But the last 10 months have showed us that, this may be possible. You could come and live in Israel and keep on holding your business or your work from a distance.
Let's switch gears a little bit to families and children. You have a program called Youth Villages. Can you talk about that and how you're dealing with the stability of children at risk during the pandemic?
We have 5 youth villages across the country, which is really a boarding school where kids who are coming from at-risk families, many times dysfunctional homes that unfortunately the parents are not able to have the kids grow in their house, and therefore the recommendation of the authorities is for the kids to be educated and living outside of their homes. And therefore the villages really becomes their homes, and the different counselors and mentors and the staff become their kind of alternative family. And so during the pandemic, we have about 1,000 teens living in those 5 youth villages. Many of them come from more weaker populations, from Olim families, from Ethiopia origin families, and from other at-risk regions in Israel. And so in the pandemic, what has happened is that the Ministry of Education shut down the educational system as part of the lockdown, like in many other countries. But about a quarter of those kids don't really have a home to go back to. So what we have done is we kept the villages open, we kept our staff and team on the ground, and made sure that those teens have a home to stay in.
You also have many other programs, one being Youth Futures, which is also helping young children that are at risk, and you have mentors. And unfortunately, we don't have enough time to talk about them, but on a final note, what do you see moving forward as the most critical need right now?
Yeah, so I would say what has happened to us at the as the outbreak began is the understanding that the populations we are responsible for their life 24/7 are the ones that we had to immediately respond and address. So whether it's our 1,000 kids in the youth villages or 7,000 senior citizens, which we have in 57 old age homes, or whether it's the thousands of new Olim who came and had to be quarantined. So our first and foremost responsibility was to take care of their immediate needs. As we move along and look into the next couple of months or a year where we understand a lot of recovery would be required to help those populations, even if routine does come back to some extent, those who were so fragile and vulnerable then would still need us to be there for them. So we are actually looking and adopting all our work with youth and families at risk, whether it's in the villages or the youth futures or in the old age homes, and are estimating what are the current needs that they specifically would need in the next year or so until economy is back and until they're able to somehow go back to a routine. On a last note, I want to say that we work also all across the globe in more than 65 countries and communities. And as this pandemic and crisis took place at every corner of the world at the same time, we found ourselves having to serve communities, mainly smaller ones outside of North America, who didn't have the local capacity or the local government stepping in to help. And therefore, we're actually under crisis, not being able sometimes to provide the very basic services of the community, welfare or social services or educational. And it was very clear to us that as a global Jewish platform, we have to be out there for them. And so we have assisted dozens of community organizations in dozens of communities around the world, in places like Chile and Paraguay and Spain and France and all those little more smaller communities, assisting them in many ways. And we anticipate that we would have a role to keep on continue supporting them in the next year or two, confronting with the implications of this pandemic.
Amira, you do such incredible work all across the world, and our federation is a big supporter of the Jewish Agency. Shalom and lahitrot.
Thank you so much, and I want to take the opportunity to thank you, the leadership of your community and the generosity that you have all demonstrated, which is so truly appreciated anytime, but even more so during this period when we know that you, as any other community, have your own local needs. And even though you've been there to support Israel and support the critical work we do in Jewish communities around the world. So thank you so much on our behalf as well.